most famous physical therapist on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course,
I'm
Bob.
shaking here, Brad.
Bob, are you doing a plank?
I'm planking, baby.
Okay. Bob, is there any other way you can do that plank?
Oh, yeah, there's other ways. We can go like this.
Yeah, go ahead. Are you having fun, Bob?
Yeah, this is a lot of fun.
Okay, planks. You know, this is just my opinion, Bob. I'm not a big fan of the planks. I kind of think they're a fad, and a few years from now I think people will not be doing them, and I think there's some options that are much superior to the plank.
And I agree with you, Brad. I saw planks, and the first thing I thought is it's an isometric exercise, and isometric exercises don't work the whole muscle. I mean, like if you're working a bicep, and I go like this, and it's isometric here, I worked it in that range.
Right.
Now I have to work it here, now I have to work it here. You know, it's just...
Exactly.
It doesn't seem like a complete muscle strengthening exercise.
But it is hard, and it can cause that muscle fatigue and pain, and for some reason people relate pain in extreme with good, and I don't think that's necessarily the way. And if you keep listening, you're going to find out what the better option is, in my opinion, of course.
Oh, by the way, Brad, a lot of you are new listeners to our channel, and we want to make sure that you take just a minute, please, and hit that little subscribe button. It's right on the screen here, because we upload videos every day on how to stay healthy and fit and pain-free.
Exactly. So, say no more, Bob. Okay, what is the better option? As normal, it's the people who have been watching videos, they know me, they probably know I'm going to say...
The ball.
The ball.
Yeah.
The ball is wonderful. It's been around for decades, and it's a proven piece of workout equipment. It's affordable.
And it's cheap. Yeah. Oh, that's what the same thing. Affordable and cheap are the same thing, aren't they?
We learn more every day, Bob.
You know, the only one thing in defense of planks, Brad, and we were talking about before we started here, is that, you know, it's a static strengthening. So like when you stand up, maybe you can translate it to standing. You know what I mean?
Right.
That, like, because I'm strengthening my core here. Now when I stand up, my core, I tighten up my core like I would with a plank.
Right.
You know, I mean.
But you know, if you want that stronger core for most activities, basketball, skiing, swimming, you're moving.
Yeah.
You're moving, and there's a component of balance that you need to want to fine tune for any age, whether you're in a sport or you just want to keep up so you don't fall down and break a hip.
Yeah, you're gonna. How are you gonna hurt your back, Brad? It's not when you're standing up straight. It's gonna be you're moving and doing something, and that's why you want your core to be strong with the movement.
Exactly.
And that's why the ball works so great for that.
And we'll point these out with some of these exercises. Shall we carry on?
Sure.
Okay.
You want to start with exercises?
Yep, you're going to
Brad?
have to move though, Bob.
Okay. I am moving.
All right. So first
here.
of all, get a ball. This ball is about the right height for me. If it's too small or too big, it won't work. But this
I'll link up, Brad, to the how to measure a ball, how to choose a ball.
Quick thing: if you sit down like this ball is too flat for me, but I can still use it. There, you can. It's forgiving. You can see my butt's down lower than my knees. You want the butt about the same height as the knees.
So your thighs are level.
Exactly.
Sure.
All right, now this is one of my favorite ones. When I get up in the morning, if I do these, I like to start with this one because I'm only half awake. And
Brad, can I tell them, Brad, by the way, has spondylolisthesis.
Right.
So he needs to do core exercises, and these core exercises have kept you functional.
Exactly.
And out of trouble.
And they're completely pain-free on my back, and that's why I do them. So if you do happen to have that diagnosis, I strongly urge you to work these exercises. Okay, so all I'm going to do is grab a hold of that ball, and I'm going to lift the ball up in the air. Now what that does is it pushes my back in a neutral position, which is desired for strengthening your core, and then I'm going to just do this.
Are you pulling your back down a little bit too, Brad? I mean, are you trying to hold? He's trying to, you know, stop this arch from occurring.
Right.
So he's squeezing my hand here.
That's the beauty of doing this exercise.
It kind of does it automatically?
It does it automatically.
Good.
It's wonderful. Okay. Now, if you just started this, 10 will probably be enough. But as you get stronger, you can continue more and more and more. Now,
can you do it to the point where you start feeling it burn in the stomach? That's
right
okay.
there, exactly.
So.
The next one, there's a lot of them. I'm just going through a few of them. Cross here, okay. Kind of like you're in the casket, but you're not. Arms here. Elbows are going to go to the knees.
In the casket? All right, go ahead. Keep going.
I saw a joke on that once, Bob. Anyways, elbows to the knees. And again, no stress on the back. but this adds a little more effort needed for the abdominal. Works the upper abs a little bit more, plus the lower abs. Don't let your head go up like this. Keep it neutral if you
he's
can.
really almost trying to bring his head straight up to the ceiling.
Right.
That's so.
Now, I know what you're thinking out there. You're thinking, yeah, but what about all this balance stuff that you're talking about on the ball? True, these do not have anything to do with balance.
You're working towards that, aren't you?
Right, that's coming up next. There's one more on this I want to show everyone, though. You want to work the oblique muscles. They go this way, and that's for that rotational support. Back to this position, right elbow to left knee, here, here, and you're not twisting a lot. You're not twisting like when you're standing and bending, so it doesn't stress the back in a bad way. And if you got an itch on your back, right back here, it scratches your back at the same time, and it feels really good. So you want to do it more and more. You
Again, he's holding his head straight up instead of bending it forward. So,
okay, next one, prone.
although again, if any of these bother your back, don't be doing it.
Exactly.
Right.
All right, prone position. Should I do them up here?
You think you can?
I can. I would not do them on a table at home. On a carpeted floor is desirable. All right.
I'd like to see you do them on a dining room table, Brad.
At home I do, Bob. I just show off to my wife. Okay, now this is a beauty of it. Supports the back, and you start to lift here. You're working the hip as well as the low back. Oh, thanks, Bob. And then I'm going to work this one. Now we're starting to get that balance.
Yeah, this
involved.
is great too. It's very good for core overall.
Exactly. And you can vary how hard it is. If I do them here, much easier. Or if I go down in this direction, much, much harder. Now, if this gets too easy for you, then I'll go to this position and I'll lift both at the same time.
Wow.
Now that starts to get much more aggressive, and especially if I roll back this way, then, oh my goodness, much harder. Or this way, much easier.
Sure.
You can vary.
See the progression.
Oh, it's wonderful, Bob.
What do you do when you're on the floor and you don't have anything to grab? Well,
you want me to show you, Bob?
No, that's all right. You just get your hands.
Yeah, actually, I never go to that position. I was doing it for demonstration.
Sure.
Because it's pretty hard to go out that far.
Sure, and that would involve a lot of balance then.
Right.
Yeah.
Exactly.
Oh.
All right.
So you want to do a few seated ones?
Oh,
Brad?
no! I forgot, Bob.
Forgot one.
This is the great one here. Here, now you want to work the upper back, like this.
Oh yeah.
Okay, and you're going to do, on all these, between 10 to 50 reps is
For
good.
most people, this is a fantastic one to do for your back.
Sure.
This one doesn't bother you though, Brad.
Not at all, because the stress, because of the ball supports the mid-back so much.
Sure. Most of your motion is coming from up here, isn't it?
It's the beauty of the ball, Bob.
Yeah. Because normally this would be an exercise that would probably bother somebody with spondylolisthesis, is extensions. But
yeah, but on the ball, you can get away with it.
You get away with it.
Yep. And I do add rotation within a completely pain-free range. I don't push it, but I don't want to lose range either over the course of my life.
Exactly.
Okay, now
that's actually a good one for golfers, by the way.
Oh, sure.
Yep, that works that core and that rotational.
Right, and then if you want to get it more aggressive, you do it without your hands on. This is easier, this is harder, and if you want to grab some weight and put some weight into your arms, for those people who are really
do the
strong.
Superman too? Way out like
well,
that?
Yeah, you could do that as well. No, exactly. Plus, the ball's wobbly, and I've worked on the ball for years. If you just start,
Brad makes it look very, very easy. Whenever I try these after he's showed me, I'm like, oh my God, I can't even get on it. So
your balance definitely is challenged. Wow, Bob. Now I got one
breath?
more. I got one more, Bob.
All right.
This is for those people who really want to say, oh, those look pretty easy. Then
Brad wants to challenge you.
Now with this, I have to go with my feet up against the wall.
Let Lonnie find you first.
Okay.
I'm going to move the spine.
Now the beauty, I see people in the gym, they'll go up on one of those benches and they'll do these back arches where the bench stops right there, and they'll arch their back forward, and they're doing wonders for strengthening their core, but they're tearing their back apart. So here, you let
the back is supported.
Exactly. And then we do this with the ball supporting the back. And we can also do the obliques Bob, you want to grab me some weights?
Sure.
And if you're in the gym and you really like to have some iron, you grab a 45-pound plate or 25-pound
You want the black one too?
No, this is enough. Okay. It doesn't take much really, and you get these up on your chest, and then you can tell by my grunting, hopefully that covering up the mic, that this becomes much more difficult.
Again, normally we wouldn't want you doing this, but because his back is completely supported,
yep,
you can get away with this.
By the ball, plus you're working your balance at the same time.
Sure.
A lot of other core muscles are working. We're on a solid bench, you don't get that benefit.
Yep.
So,
I mean, we would absolutely not want you doing, you know, these. You know,
right.
That's hard on the back.
Yeah, exactly.
But with the ball supporting the back, you can get away with it. So, all right, Brad. Remember, we can fix just about anything
except for that broken heart. But we're working. Yeah, I'll point at it right there.
It's
I'm tired, Bob.
All right, I'll finish up. Thanks for watching.